typically when we think of diabetes, we think of things like signs and symptoms like polyphagia, polydipsia, polyuria. Those are what we call the 3 Ps. What they mean is you're eating a lot, you're drinking a lot, you're peeing a lot. Then we also think of things like vision changes, and we also think of things like numbness and tingling in the extremities, and sometimes also fatigue. So we screen for that. We'll go and screen when someone comes in with those symptoms, and or you can screen obviously when there's a regular screening. If there's lifestyle risk factors, obviously annual wellness visits will do that a lot, and then also if there's a high risk family history. So those are the typical reasons why we will often screen. And then I think that gets missed quite often actually though is when there is a candidal rash. Candida in general, yeast, is an opportunistic infection. So in other words, it's really mean because it likes to take over when the host, aka the person, is not doing too well. So it's immunosuppressed, aka like in diabetes. I cannot tell you how many patients that have come in with just a candidal rash and nothing else, and I screened them and they end up having diabetes. So what is a candidal rash? What does it look like? Well, it's going to be a beefy red color. It almost looks like it would hurt. Sometimes it's a little itchy. It doesn't necessarily hurt, but in those areas that it tends to like to be, like the folds where it's warm, dark, and moist, everyone's favorite word, it can get macerated in there because moisture likes to be in those places, and so that maceration can actually break down tissue. So in that case, I guess you could have some pain with it, but typically it's not super painful at all, but it is that beefy red. And also, if you were to open the folds, it would look like one side matches the other side. And it also has little satellite lesions, little dots that come off of it, little red dots that come off of it, and it's well demarcated, so that kind of almost like that circle or that mirror image side, you could almost draw a line around that area. Something that I would definitely say to go ahead and get an A1C for, to check for diabetes if you see that.